Hey everyone, my name is Yahia.
I'm Lizzy.
And we're here representing Libi Medical. So when we started this project back in August, what our department did was they proposed sending a team to Ethiopia for the first time ever to do their senior design project in a developing world setting. So what we did is, because we believe that technology is for everyone, no matter what background they have or what money they come in with, we took this project on and we actually flew to Addis Ababa the week before the semester started and shadowed the clinicians and engineers there to see what their needs were. And what we found was that they had really, really skilled people, great doctors, great engineers, and they just had certain technology gaps that were due to the monetary restrictions of their economy. So one of those areas in which technology really got in the way of what they were trying to do was in fetal heart monitoring. So in the United States, what we use is these devices on the right here, where we use ultrasound to detect the fetal heart rate, and we use that as our primary vital sign for the fetus in the prenatal period and during labor and delivery. Now in Ethiopia, they have these devices, but they're really just not durable. You can see these two devices on the right are actually broken. Those are actual pictures from the hospital there in Ethiopia. And what they're left with is this simple device called a fetoscope, where they put their ear on one side and they listen for the fetal heartbeat by pressing the other side up to the abdomen. Now this is all right, but it's a very rudimentary piece of technology. It doesn't record any data, it's not shareable, it doesn't do telemedicine, all these things that we'd like. So it's not where Ethiopia wants to be in the future. So to get a feel for what we're working with in Ethiopia, they have 9,000 infant births daily, and they also have an infant mortality rate that's unfortunately high at 5%. That's 10 times higher than what we have here in the United States. So the Ethiopian government has actually made it a priority to lower that number down to 1.3% in the near future. So they're very supportive of this mission. They also have a population growth rate that's 2 times the global average. So this is an economy that's going to be growing, and it's going to have plenty of people to use this product in the future. So that brings us to the fetoMic. What the fetoMic is we've taken the fetoscope and we've added a microphone to the bottom. And what that microphone does is it picks up the sounds coming up through the abdomen, the same that the doctor would listen to manually, but now we can do it digitally in hardware. So that signal is fed through an aux cable straight into your phone's headphone jack, and you can actually see the tracing of the heartbeat over time and record the signal to share with others. We've done some engineering tests to validate that this concept actually works. What we did here on the top graph is we actually played a 150 hertz sine wave through this model on the right, which is actually supposed to simulate the mother's abdomen. So the speaker in the middle is playing that sine wave, and we're picking it up with our device through about 6 inches of gel. And you can see a clear spike in the frequency domain where the 150 hertz is. On the bottom, this is much more compelling in my opinion, is we actually see fetal heartbeats that we can pick out very clearly in the signal. So that's exactly what we want to be doing in our app moving forward. We've actually been approved to do a first-in-human study here in the United States at Peachtree Women's Clinic, just up the road. And we're going to be working with 35 subjects in that study, and we actually started that yesterday. So we're going to validate this device here in the United States and then take it over to Ethiopia, where we're going to be conducting a 10-week validation study this summer with at least 72 subjects in Ethiopia's primary highest level hospital, which is called Black Lion Hospital in the capital. And our aims there are going to be to collect signals, to validate our device against existing devices, and to evaluate whether or not this device is usable by the local physicians.
So in the last couple months, we've looked a lot into how do we make this model sustainable. That has kind of been our goal from the very beginning. And so just to give a little bit of the scope of the project, fetal heart monitoring is expected to reach $3.5 billion globally by 2022 with significant annual growth. And as populations continue to rise, we expect that to continue growing. Ethiopia has been dubbed the China of Africa in many ways because of its economic and population growth. In the next 30 years, they expect the population to double, which is fascinating to me. We thought it was interesting that in 2017, Ethiopia imported $103 million worth of medical supplies and equipment, and yet manufactured none, despite growing industries. And on a small scale, we want to help change that. And so looking at what's currently in the market, Ethiopia has government-subsidized healthcare, and all of the medical device equipment acquisition goes through one primary channel, PFSA, the Pharmaceutical Fund and Supply Agency. Now, PFSA gets these devices and distributes them in one of two ways. Either they're donated from humanitarian organizations like USAID and MedShare, which is Atlanta-based, or they buy them directly. And we have encountered just a couple manufacturing companies like Laerdal that have begun designing fetal heart monitors for low-resource settings, but we have yet to run into another phonocardiography approach, which is what we're doing. One freedom that we've enjoyed is that Ethiopia is not a member of the Patent Cooperation Treaty, and so that hasn't been a major part of our project, pursuing intellectual property here in the US. But I'll talk a little bit more about that later. Contingent on the results of our clinical study, we can obtain regulatory approval to operate our device in hospitals in Ethiopia fairly easily through the Ethiopian Food and Drug Administration, specifically the Food Medicine Healthcare Administration and Control Authority. Our device has non-significant risk, making it a Class 1 device, which enables a 3 to 6 month approval process of only $750, which is great. So right now we expect that it will cost about $20 to create the fetoMic, which really fills the gap in the current market, enabling advanced technology at a fraction of the cost of these other devices, more advanced devices. So the key point to our project has been we found a resource in Ethiopia that we did not expect. As we were touring the tertiary level hospitals, each hospital is staffed by full-time biomedical engineers that have a 4-year training program very much like our own. We talked with them and heard about their innovation projects, and we knew that if we could design something that we could build, they would far exceed our capabilities. And so our goal has always been to transfer our plans to these Ethiopian engineers so that they could run with it and perhaps pursue their own intellectual property in Ethiopia. We think this could be sustainable in one of two ways. To the 116 tertiary level hospitals that have these full-time engineers, we can provide them with this kit model, with the materials, the manuals, and the support to build these devices in-house and repair them. And this is much more sustainable than what's currently happening. Now, we have to keep in mind that there are regional and community health centers that don't have this precious resource. And so to do that, to equip these hospitals, these clinics, we hope to support teams of Ethiopian engineers to build that and sell it directly to PFSA. So as Yahia touched on earlier, moving forward, we are conducting 2 different clinical studies as we continue to design for manufacturing. But long-term, our goal is to transfer all of this to Ethiopia. It has always been our goal to have this to be a device built in Ethiopia by Ethiopians. We couldn't have done it all alone. We're part of a much larger team. We're actually all undergraduate students. Most of us are graduating either in May or in August. There are 4 of us that are biomedical engineers, and then this semester we brought on an app developer and an industrial designer who have been pivotal to our progress. And we want to give a shout out to our advisors, Dr. Gleason, Dr. Stubbs, and Dr. Mahalit, who have advised us in research, industry, and medicine. As mentioned earlier, we had the opportunity to present at the Rice 360 Institute for Global Health, where we took home first place and the People's Choice Award. That was really gratifying to be able to present at such an institution that has these strong ties to the global health sphere. We're really grateful to be able to share our ideas with you. We hope that in some way the fetoMic and Libi Medical can help, transform the process of childbirth and make it safer. Thank you very much.